in the 90s, the malpractice crisis really happened. And the rising cost of malpractice and the inability to get cost-effective malpractice and the declining reimbursements made me look at whether I could keep the birth center open or not. And I was the first birth center to open in the state, and I was the last to close. But the other birth centers had closed in New Jersey. Ultimately, I closed the birth center, and I moved to Pascack Valley Hospital, which was the hospital that I had started at so many years ago. But they wanted the numbers. So we did an in-hospital birth center at Pascack, and it was perfect. It was lovely. They let me do what I wanted, and I was really happy there. I was happy there. We were doing lots of numbers, and then the hospital closed after 4 years. They went bankrupt. Because although the OB department was doing well, the rest of the hospital was not. I journeyed again. Now I didn't have a birth center, so I went to another hospital, Palisades Hospital, and again, I just wasn't a good girl. Just couldn't be good. And the nurses wanted me to bring the patients in. They couldn't quite understand why I didn't want them to have an IV. Why can't you just put them on the monitor, put the IV in, and then everybody's happy? Yeah, they're happy. They can sit at the nurse's station and look at the fetal heart from the nurse's station, and this poor woman is then going to want an epidural because she can't handle it. You can't be strapped down in bed and handle a labor. You need to be mobile. You need to be allowed to labor the way you were supposed to labor a baby. They just couldn't quite get it. They couldn't quite get why my patients wanted natural childbirth to begin with. Why would you want natural childbirth? It hurts. Okay. That pain will strengthen you. That pain will change your life. It says in the Bible, in pain you shall bring forth your children. Okay, so we do it. But we do it. I recall this lovely young woman. She was a weeping flower. You could blow her over with a straw. A little wind, and I used to think she'd fall over. And her husband was really pushing her to have natural childbirth. He was a healthcare provider. He was a strong man. He was a chiropractor. And she was a tiny little girl giving birth to her first baby. And I worked hard. And she did it. She birthed her baby with beauty and strength, and it was a beautiful birth experience. But what she said to me after made it so, we worked hard together, but she said that she could never be the same woman again, that it transformed her life. It made her realize how powerful she was, how strong she felt. And it was an amazing change in this woman. It was so amazing that it personified to me really what this was all about. That pain can be so strengthening. It can change a woman's life. It could change her journey. And how great is that, So, I traveled around with hospitals. Of course, I left that hospital, and I'm now at another hospital where I feel respected and able to serve women. We take transports I always took transfers, home birth transfers from the midwives in the community, be they CPMs, CMs, CNMs, whomever the provider. If a woman needed us, we were there to serve them. Along the way, I did a lot of things for the college and for midwifery in general. In the early years, being a renegade, having an independent practice was not always, the appropriate thing to do, because in 1981, I was brought up on charges for practicing medicine without a license by the Board of Medical Examiners because I failed to diagnose a blood pressure that went from 106/64 to 120/80. And they said that that patient was preeclamptic and I should have referred her to the doctor because she was sick. It was a way that they were going to try to limit my practice. And I must admit, Sister Angela, she was a past president and a wonderful midwife who started the first birth center in the country and was my expert witness and helped me both emotionally and emotionally and medically. You know, she was my witness. And they put me on probation for a year. But they didn't, it was an unspecified probation. I didn't have to do anything. I just had to keep my nose clean for a year. But it never went away. I mean, you always have to report it. It was with me for the rest of my life. Today, I still report it. If I apply for privileges at a hospital, I have to report it. It's a reportable incident. I had no trouble since then. Well, I did have one trouble, but that was sealed. I was brought up on charges for doing a circumcision, and because it didn't specifically say that midwives can do circumcisions in the law, in the midwifery statute, but I was Jewish and I had the Jewish. I was a mohelet, so when they brought me up on charges, they, court reporter and the whole thing, and they said, "Can you tell me if you only circumcised Jewish infants?" My reply was very, very honestly, gee, if Jesus was a Jew, and a Christian is not determined a Christian until they're baptized or christened, I assume I only circumcised Jewish infants. At which point they coughed a lot. They found me not guilty, but they made me go to an ethics class. But they changed the statute. They changed New Jersey statute to include circumcision as an approved privilege, approved surgery that midwives could do. I used the legal system to extend our practice. I did testify in the early 80s at a House subcommittee hearing about the limitations of midwives' practices by the physician. And that helped a little, but that didn't make me, that didn't put me in good stead with the powers that be, the licensing bureaus. But it was something that I did do. When we had the malpractice issue, we lost our malpractice insurance, and essentially midwives across the country were not going to be forced out of practice. I hired 2 buses, as well as a hospital in Newark, Jersey City it was. I bussed 2 bus loads, and they bussed 1 bus load of pregnant women to the State House. And we stood outside the State House. I had a megaphone, and I was going, "What do we want? Insurance! When do we want it? Now!" People were carrying banners and placards that said, if you could insure cars, you can insure midwives. And, I had a signed petition that I was going to be giving to the governor when he came out of the State House, and he came out and I presented him with this petition, and all of a sudden, "Oh, come inside, we want to speak to you." We got malpractice insurance. We did. There were a couple of legislators that said, "Oh, come inside, we'll talk to you. We'll get it. We're going to solve this right now." We went home very happy. We got malpractice insurance. And then I did go to Washington, to the CNM, and they heard my story. And a lot of the states started falling under, and they started getting malpractice insurance. And they also developed a national program through an insurance company. But we did a great job in New Jersey. There's nothing like motherhood and apple pie and big pregnant bellies to encourage the legislature to hear us